Okay. Oh. So let's start from the character. Okay. Shen, sorry. Shen, this character. Is made of two main characters. One that is like this one, that means that is indicating something or is referred to our ancestors. And the other is this one that gives the sound to this character, Shen. But it's also refers to something that have to reach out, that is moving out of something, or something that is standing himself. The ancient character of it was more or less like this. You can see that it's like a communication between up and down, whatever it is. It is like a lightning. It's like lightning, no? And lightning was a very young phenomenon. Because Shen is the most young element that we have in our body. So Shen is something that we have that it's like it's reach out to for us to know the world that is around us. So through the Shen, we can perceive all our around, and we can be conscious about it. So if you have some disturbance of the Shen, then you can't perceive very well the reality, what Buddha, the Sakyamuni, calls the reality. Normally, for Sakyamuni, this reality was blocked because of our emotions. There is the third patriarch. It's called the third patriarch of the Zen Buddhism, Shen, that he believed that that the mind, normally we believe that the mind have diseases, but he believed that the mind was the disease. So what he means is that if you have any emotions, you already start to have some diseases of the Shen. Sorry, still is people that is coming in. So Shen, being very young, is very subtle. It's a very subtle substance, and anything that is yin will disturb the fluidity of it. So in our body, normally things like damp or phlegm will, or anything that is yin, will in some way will disturb the circulation of this Shen. Also, Shen will be affected when there is a deficiency of yang, because Shen and yang is the same thing. So we can say that Shen, yang, and the warmth of our body all are related in some way. Normally, in Jing Fang, we don't speak that much about Shen, but we related all the Shen diseases to specific herbs or formulas. I will. So normally, when we do any, let's say, diagnosis of any to prescribe any formula, we have first the pattern of the formula, which is the same as the syndrome of the formula, the function, which is the signs and the symptoms that the person have in that moment, and that goes like a key and a lock, very together with the disease that have, or the syndrome that have the person in that moment. Then we have the constitution that have that patient, which is the physical constitution and some psychological tendencies that the person can have. And then we have the disease. This is three factors that we will see, or we will take in account when prescribing a formula. So because for us, let's say that physiology and pathology are just an expression of any formula or any herb, so anything related to the Shen, we explain through the herb or a formula. Okay, so I will explain maybe 2 or 3 herbs so that you can understand what I mean. Okay, so let's start with chai hu. Chai hu. For those that have some difficulty with the Chinese name of the herbs or the the formulas, some of my students will write for you in the chat the name of the formulas. Please, Joshua, if you can write the name, please. Okay. So let's start with chai hu. Chai hu is a very common herb that is used in our Jing Fang. It's one of the most used herbs in Jing Fang, and it's used in many, let's say, emotional diseases. The chai hu is a Shaoyan herb, and let's say that the formula that represent chai hu is xiao chai hu dang. Xiao chai hu dang. So xiao chai hu dang have very specific characteristic. Well, many people are very specific characteristic, and one of them is called xiong xie gu man. Xiong xie gu man. I will write for you. The other is 1,900. Let's start with 1,900. 1,900 normally we translate as alternate chills and fevers. But our professor, Juan, he understands that also as cyclical symptoms that the patient can have. These cyclical diseases symptoms could be, for example, a monthly symptom or a seasonal symptom. But it's also, and this is the psychological part, it's also is related also with the no adaptation of this person to different conditions, social conditions, chemical conditions, physical conditions, seasonal conditions. For example, this person that is a childhood person, we call it a childhood person, will every spring will have some allergies to pollen, for example, because he cannot adapt to this change of season. But also, this person, for example, if he's in a room and we open a window, this person will feel that it's cold. He cannot adapt to that change. But then he will close that window, and then he will feel like there is no air circulating, so he will feel suffocate. So he will open the door again. So this kind of people will be like a roller coaster in emotions. These people will have a lot of emotional change during the day, or once a month, for example, will feel sad. We can relate that, for example, in some premenstrual syndromes. For example, when the patients will feel some emotional distress. This is a very childhood condition, a very childhood person. Normally, a childhood person will be like this. This is from Professor Juan's book. So as you can see, this person has like very long eyes and small eyes. You can see that these have very small eyes, and this person will be he won't believe other people. He will be very doubtful of other people. So the problem of our childhood person is that the qi doesn't flow very well, because the qi or the Shen, which is the same, the Shen have to flow, have to go in the Shaoyan. He goes in the Shaoyan, and in the Shaoyan there is a little bit of damp. As I say, a little bit of damp can stop the Shen from circulating. So this person will have a difficult moment to adapt. So he will always be doubtful of any person. So a Xiao childhood person will have very agey face. As you can see here, it's a very agey face. Here, very agey face. And this is a Xiao childhood person will have a deficient condition mainly. In Xiao childhood, this formula we have Gan Cao, we have Da Cao, and we have Ren Shen. All of these herbs are yellow, they are sweet, and they are warm. So they will nourish the earth, just that they can hold this fire, they can hold the Shen that is trying to escape. Sorry, still is people that is coming in. So this person normally, because it's a deficient condition, this person won't be very extrovert. It will be an introvert person. It's all the opposite to rhubarb, Tahuan person. Tahuan person is a more excess condition, and it will be, let's say, a more extrovert person with a more bulky constitution, while childhood person, Xiao childhood person, is a more thin constitution. So a childhood person socially is not a very social person, let's say. And this kind of patient will take all the emotions in. It will take all the emotions in, and suddenly it will express out in a very strong way. You know, he will express it in a strong way. So this is the 1/100. This is why sometimes it will the Shen will be very weak, and then it will goes up, very weak and goes up. So this is like it will come up and down, come up and down. So this is more or less the childhood person. Most of these people, because they have not the Shen cannot flow freely, so these persons will accumulate in the sides. Will accumulate all these fire or emotions. No, so they will feel like a fullness in the thorax and an uncomfortable feeling, like something is pressing the chest and the sides. So this is what we call 胸胁苦满. Because of this, because there is an stagnation of this qi or the Shen, then these persons will won't have appetite. Normally, this person won't have appetite, and they won't talk a lot. Remember that talking, the word, is something that belongs to the heart, and the heart is the one that stores the Shen. So if you have a weak Shen, then people won't talk or won't express or won't communicate with Xiao Chaihudan, because as we said before, it's a deficiency condition. So Xiao Chaihudan people or childhood people won't really talk a lot. This is what we call in Chinese 默默不允许. There is another formula of that have childhood, which is Sinisan. This formula have childhood, have 知识, have 白勺, and have 甘草. In this case, in Sinisan, this formula, there is an stagnation also of energy, but the stagnation, the emotion, is all concentrated in the center and cannot flow to the four limbs. So according Professor Huang, Sinisan people, they are not as deficient as Xiao Chaihudan. So, but they will need a lot of adrenaline. They like adrenaline to move the energy. So Professor Huang says that people, Sinisan people, like very spicy food because they need to move the energy. They need to move their emotions. So this is why they like, for example, extreme sports. This kind of people like extreme sports and extreme situations to move their energy. Normally, Sinisan people, we have red lips, red tongue, and cold hands, and an uncomfortable feeling in the epigastrium here. This is what we call stagnation. Xiao Chaihudan and Sinisan all are stagnation of qi. an stagnation of emotions. These people have a problem with this stagnation of the emotions. So chaihu, which is a bitter herb, will dry this damp for the Shen can flow freely. So this is the function that have the chaihu in this both formula. Chaihu is a great herb, and Professor Huang used xiao chaihu tang and sinisan in many depressive disorder cases. Let's talk about another herb. Let's talk about huizhi, cinnamon. Oops, sorry. Huizhi. Huizhi is a pungent and warm herb. It can restore the flow of the qi. Restore the flow of the qi in the surface mainly. He tonifies the yang. Tonifies the yang. Tonifies the yang means that tonifies the Shen. In some way, it tonifies the Shen. Huizhi people are very similar to chaihu people. Are very similar to chaihu people. Let's see. This is a huizhi person. As you can see, it's very similar to a chaihu person. But in a chaihu person, there is an stagnation of qi, an stagnation of Shen. So that person, because the qi cannot flow, because the qi cannot warm the person, so it won't nourish very well the skin. So chaihu people will be a little bit dark in the skin. You can see that there is an stagnation of that qi. So in huizhi persons, it's different, because in huizhi person we have a deficiency of yang. A deficiency of yang means that the warmth cannot nourish very well the skin. Cannot bring the blood into the skin. Cannot nourish the skin with the blood. So normally these people will be pale. Those people will be pale. So it's the opposite of chaihu. In chaihu, you will have like dark, opaque person, and in huizhi you will have a pale person. The other characteristic of a person huizhi is that in that case the yang cannot control the chou li, let's say the pores, and it will sweat very easily. So huizhi people will have a tendency to sweat. Also, these kind of people have a lot of, I would say, palpitations. Palpitations with a tendency to sweat, pale skin. So just imagine now that you have a deficiency of yang, you have a deficiency of Shen. So as in chaihu person, this kind of person also are very introvert. Okay, they are very introvert. But the difference with chaihu is that this person are introvert because they maybe are they have fears. They have a tendency to have fear. Yang and courage goes together. If the Shen is strong, the person will be courageous. If the Shen or the yang is weak, so the person have a tendency to have fear or panics. So this is why maybe also the heart doesn't feel very stable. So it will have palpitations very easy. There is a formula that we call quy trì cha quy tang. Quy trì cha quy tang, where we have the biggest amount of quy trì in the Shanghan Lun. So quy trì cha quy tang describe a condition of what we call pentun, and pentun is very similar to a panic attack, a person that have a panic attack. So we can say that quy trì is related to that panic, because in that formula we use the highest amount of quy trì. So a quy trì person. So imagine that you have this is the person, and you have your heart here. Your heart that projects to everywhere the Shen, no? But now, because this Shen cannot reach the stereo, as we just say, remember that the character Shen, this Shen means to reach, to extend, to reach the stereo. Now this Shen cannot reach that stereo. So that person have a difficulty to learn, a difficulty to be conscious about what is going on around him. So quy trì people, they are not very conscious. They cannot feel a lot what is going on around them. So imagine that you have this is your eye, and the eyes are where the Shen can express, no? So the Shen in quy trì people cannot reach the eyes. So people that have a deficiency of yang, or quy trì tam people, or quy trì people, they have no they have no life in the eyes. They have no brightness in the eyes, no. But they also cannot perceive very well the surround. So people, quy trì people, they just walk in the street. Maybe you just say, hey, and they won't see around because they are not aware of what is going on around them. Also, when you have a yang deficiency or quy trì people, they have this this difficulty to learn things or to keep the knowledge. So this is why quy trì can sao tang, or quy trì dan, these two formulas are very good to move the blood, to go to the stereo and to learn, okay, to learn the things. So if you want to memorize things, these are the two formulas that you should use to strengthen the yang, to strengthen your Shen, and to be aware of what is going on around you. This is more or less the quy trì person. So you still have to remember this quy trì person have a tendency to have these fears, panics, it have palpitation, it have a sweating. So as you can see, because the yang cannot hold it, so the yin goes away. But because the yin is also deficient, so the yin cannot hold the yang, cannot anchor the yang. So the yang also floats and goes up. This is why in the Shanghan Lun says that quy trì dan formula, the pulse will be always superficial. The pulse will be superficial in these cases. everything is escaping. No. So this is also a deficient condition, like in childhood, or in childhood. And we can see that Jing in both formulas, 小柴胡糖 and Quichidan. He used 甘草、大草、生姜。In both formulas. This is common for these two formulas. So these are all yellow warm herbs. They all go into the earth and move the earth and nourish the earth. Why? Because the earth is the more yin organ that we have. So it will create all the yin in our body, and it will hold our Shen when the Shen or the fire or the yang want to escape because it's very weak. So you have to keep in mind that always when you treat the Shen, you have to strengthen the earth. This is a very important. Of course, it influenced another doctors that came after, like Li Dongyuan. He also speaks about the tonifying the earth to hold the fire. He has Li Dongyuan have this concept of the yin huo. I'm sure that many of you have heard about the yin huo, which is the yin fire. It's called the yin fire. And the yin fire is a fire that is a rebellious fire. It's a fire that is flaring up. And he believed, Li Dongyuan believed that that fire will flare up or will be rebellious because the earth wasn't enough strong to hold that fire. You have to understand that when in Chinese medicine we speak about the Shen, we are talking also about a physical condition, because Chinese don't separate this concept of Shen and the physiology of the organs. For them, it's just one thing. The idea of separating the Shen or talking about the Shen only is a Western idea, completely Western idea. So Chinese believe that tonifying the earth or strengthening the function of the earth will hold that Shen or will make more strong that fire. And you will see that I change from yang to qi to fire to Shen, because they are all the same thing, just they project in different ways. So, but they are the same thing. And you have to understand that. I know that many of us studied those terms as a separate thing, but they are the same thing. So let's talk about another one. Let's talk about Panxia, Pinella alternata. Panxia is also a pungent herb. It's in the Shen Nong Pen Sao Jing. Shen Nong Pen Sao Jing. Let me write it. Which is maybe the pharmacopoeia that Zhang Zhongjing used. 小经 in the Shen 边小经，pan xia kan xia qi. So xia qi means to make the qi descend. Make the qi descend. This is mainly what pan xia will do. Pan xia is related to the Tai Yin. It's related to the Tai Yin, and as you know, Tai Yin is related to the earth as an element and to damp. In the 6 levels, you have Tai Yin, earth, damp. No, so Pan xia will transform that damp. It is related to that damp, and that damp, of course, is a huge factor for the yang stagnation, for problems with the Shen. Normally, a Pan xia person, let's see here how Professor Juan see a Pan xia person. You see, this is a Pan xia person. This is completely different from Chai Hu and Gui Zhi. A Pan xia person have round eyes, round face. It's more related to phlegm, more related to the water. It needs these big eyes because damp is cannot let the Shen to project. So now, oops, sorry. Now this person, imagine that this person now have like a layer of damp in the eyes. Or let's just, for example, here there is a glass. There is a glass. Let's put this here. There is a glass here, and here there is a tree. Normally, if I have a strong Shen, the Shen can go and I can see the tree. But let's say that now we have a fog outside. We have a fog, and that fog now is sticking our glass now. No, this is our damp. No, now the Shen, that is a very subtle substance, is trying to go through it, but now it gets very weak here, because the Shen cannot pass. So the things that we see now are a little bit distorted. So now I have to imagine that tree. I have to imagine that tree. So Pan xia people will imagine everything. They will have these visions. They will see things that other people don't see. And they will feel things that they don't have. So this is why this woman is touching her throat. It's indicating that it have a mei he qi, what we call in Chinese mei he qi. So you have like a sensation in the throat, something that is obstructing her throat, like it's obstructing the vision. And this is the damp, that damp. But this person really don't have anything, it's just this damp is imagining everything. So a Pan xia person, when the person comes to you, he will start to speak, and he will say he will have a lot of symptoms that are not related with each other. So they are persons that they are very, I don't know how to say in English, hypochondriac, like that, yes? So it's very hypochondriac people. So they just listen that you have a symptom, they will feel that symptom. because they are all time, imagine. Because the Shen cannot express very well, so these people will have a tendency to have dizziness. Also, they because of this difficulty of the Shen to express, they will have a lot of learning problems, like they will feel like foggy brain. They will have foggy brain with dizziness, which is very common in people that have IBS, intestinal bowel syndrome. Intestinal bowel syndrome people, they are related to damp, so this is why they will feel tired, confused, foggy brain. So we can use many of the Panxia formulas, especially Panxia Hopudang, this formula. Panxia Hopudang. So we have here Hopu, because IBS patients, a lot of IBS patients have abdominal distension, have a lot of gases. So Hopu is a chiller herb, so it will treat gases in the accumulated gases, or in the thorax, or in the abdomen, in the big cavities. No. For example, you have another formula that is called Guizhi Jia Hopu Xing Si Dan, which is a formula for asthma. And asthma is just a disease where you have this thoracic fullness. So this is Hopu here is used for that. No. So this is a Panxia person. This is the damp. They will feel things like in the nose. They will feel like they have something in the nose. Some person feels like they have phlegm, or they will feel in the mouth that they have something there, or plastic or something, or they will feel in the throat something, or they will feel an uncomfortable feeling in the esophagus, or even in the epigastrium. So let's say that esophagus and the upper respiratory to the nose, all this area belongs to Panxia. But if we go and check it, if a doctor check it, he won't find anything. But the patient will feel like really very, very uncomfortable, constantly. Normally, when you are talking to those patients, they will constantly do like because they feel, they have something in their throat. So this is one of the signs that tell us that this person could be a Panxia person. There is another one. There is another herb. There is another herb that is called Fuling. Fuling is a sweet herb. It's a sweet herb that we use it as a diuretic. It's a diuretic, but this is a herb that is a diuretic of what we call 水气. And 水气, you can translate it as toxic water, in a way. Mhm. And toxic water is a water that is roaming in all the Yang system. So large intestine, small intestine, stomach, and there shouldn't be any water there. The water shouldn't rise in a form of water. The water should rise in a form of steam mainly. If the water, let's say that the water is related to cold, is related to dark, is related to fear. So if the water rise, then normally the cold is rising, and the dark is rising also. So normally when we have eyes and we see black here, this is the water. This is the cold of the water. In our Jing Fang system, this is related to what? To blood stagnation. Normally in TCM, it's related to deficiency of the kidneys. But in our system is blood stagnation. Why blood stagnation? Because the blood is warm. The blood have to be warm to circulate. And who give the warmth to the blood is the yang, is the Shen. The Shen is the most young substance of our body. But now the cold is rising. The cold is rising, so it will stagnate the water. It will stagnate the water. So this is why we will have, it will stagnate, the blood. So this is why we have this puffy eyes with the darkness around the eyes. And of course, fear will come. Fear will come, why? Imagine that this is the heart. This is the heart with the fire. The heart is the emperor. And the water, to nourish the heart, it has to come up as steam. But now the water is rising. The water is rising. So the water is rising, why? Because the yang of the heart, the Shen, is weak. So it cannot warm that water. So what happened is that the waters come up, the dark is coming up, so the fire that is very weak start to feel panic. Start to feel panic, and you see, it will escape. It will escape up. So this is why this person will also have panics, or will have tics, fasciculations, like, tics. So normally in TCM, those tics, nervous tics, are related to wind, to the wind. In our Jing Fang, it's related to the water. It's related to fooling. So fooling with the sweet flavor calms the Shen. It can calm the Shen. Of course, water and damp are related. So you will see many formulas that will have panxia and fooling. Panxia and fooling. Those formulas will be treating those panics, fears, depression. For example, we have panxia hopudang again. And we will have another formula that is Wendanta, which is not a formula from the Shanghanlun, but it's a formula that belongs to, or is, you can find it in the Sun Semiao book, in Sun Semiao's book. There you have also Fuling, Panxia. Wendantang is that formula that is used for nightmares. When you have nightmares, when you don't have courage, when you feel fear. Of course, you have also Fuling Guizhi. Fuling Guizhi is also, you have a lot of formulas that have Fuling Guizhi. And also, when you have Fuling Guizhi, these two herbs, it's also about treating the relation between water and fire, which is that 25 the fire, 25 the Shen, 25 the yang, and Fuling that drains that toxic water, that drains that toxic water, that opens the urinary bladder, to permit that this water can drain out. Of course, Guizhi, because it's a Taiyang herb, also will warm that urinary bladder together with will help also to warm the urinary bladder so that you can drain that water. Fuling, Guizhi, Panxia, Caihu. There is another herb. There is Longgu. Longgu is a mineral. It's a mineral that is sweet, and it also calms the Shen. The sweet calms the fire, the Shen. Longgu is used when this fire is weak and try to escape, when there is agitation with palpitations. Agitation with palpitations is Longgu. There is a formula where you have all these herbs together. It's called Caihu Jalonggu Moli. Caihu Jalonggu Molitan. Caihu Jalonggu Molitan have Caihu, have Panxia, have Fuling, have Guizhi, have Longgu. And Caihu Jalonggu Moli would be used when there is a physical or any chemical trauma, any physical or chemical trauma in the brain. So there is a direct harm to the Shen. Wendantang, this formula that we mentioned here, is used for PTSD, post-traumatic syndrome. So it's a psychological trauma. It's much more used for psychological trauma. It's the union of Panxia Fuling. This is a very brief introduction of some herbs and formulas that we commonly use to treat some let's say, psychological conditions of, or if you want to call it, some Shen disturbance. Now, I would be open to any question that you have. Any question? Yeah, Michelle.
Okay. Okay. Yes.
Sorry?
Okay. Can you hear me?
I cannot hear you very well.
Sorry. Can you hear me now?
Yes, I can hear you now.
I actually used Chai Hu once, but I can't even remember what I used it for. I think it was for some kind of cough. But at the time, I used very little of it, and I think it nearly paralyzed my throat. And,
It
so
paralyzed your throat. Wow.
yeah, it was very strong effect, and I'm pretty sure it was the Chai Hu because, like, I used all the other herbs before as well. So I tried again afterwards. So it just really had a strong sedating effect. So do you
Maybe,
know?
I don't know. I have never heard about that.
No.
I have never heard about that.
Yeah,
No, not
sedating.
really.
No.
No. I had never heard about that. But yeah, I think that
I was reading this in someone else's book. Then afterwards, it was saying that it can have a very strong sedative effect, but I really haven't figured out why it's that strong. You know?
小柴胡丹, maybe the panxia have this sedative effect. Because panxia in 小柴胡丹 is half a Shen, so this is more or less 24 grams. And in that that amount, it can have this sedative effect.
I use it as a tincture because I make up my own formulas.
Yes.
I use it as a tincture.
Okay.
Formula I made myself. So I don't know. I just put it in because it's supposed to help with the cough, you know.
And normally, when you have cough, normally you add you change Shenjiang for Ganjiang and add weight. This is the original modification that Chan Chongjing used in his book. Yes. So for cough, you have to add weight. You have to use Ganjiang.
Maybe it was the combination because I didn't study Chinese herbs like that, you know.
Yeah. I think that if we want to use Chinese herbs and the formulas, we have to study Jing Fang. We have to study the Shanghan Lun, because this is the base. This is the basic of all the use of the phytotherapy in Chinese medicine. And it's not only the base of the use of the herbs, it's also the standard of Chinese medicine. It's the whole, the Shanghan Lung is the standard of the whole Chinese medicine, of the clinical work in Chinese medicine. So this is why we have to study Jing Fang. We have to study the formulas of Chan Chongjing and this method. Yes.
And last question, you know, with the Fu Ling,
yes, please.
Can that also work for, you know, instead of like the steam not going up, what if the water is just falling down to ankles? Will that also help the Fu Ling?
Sorry, I couldn't understand what.
You know, when you have, instead of, you know, water going to the lungs instead of being dispersed in steam, but sometimes you have like kidney also not transforming water and water going down to ankles instead of you know, edema going up to the
edema. Yes, there are formulas of Fu Ling. There are different formulas of Fu Ling that when you combine with Fanji, there is a herb that is called Fanji, Fanji and Fulin, you can use for edema in the ankles. Yes, you can use it. Yes.
Okay.
Yeah.
Okay, thank you.
You're welcome.
Thank you, Tina. I have also one question.
Please.
Did I understand correctly? Nice to see you, actually.
Nice to see you. Nice to see you.
That the things that disturb Shen are things that are in nature, then yang deficiency and also the dampness. Are there other things that disturb the Shen?
Of course, other persons disturb the Shen. You know, it's a very subtle substance, so anything can disturb the Shen.
Mm-hmm.
Anything that rise up the emotions can disturb the Shen. But just imagine that you are, for example, in a cool room, and then the sunlight is outside, and then you go outside, and then the sun just shining, and you feel happy. For sure, you feel happy. You know, so a warm environment is very good for the Shen. It's very good for the yang. But it's outside, it's damp, raining. You know,
like in Estonia now.
Like in Estonia, exactly. I don't think that many people will be very happy. You know, this is why in Estonia, in December, more or less, you have like 4 to 5 hours of light. You know, no of sun, it's of light. So this is why you have so many autoimmune diseases there. You have a lot of depressive disorders. You know, because there is no much light. So light and Shen and yang, this is the same thing all, you know. So yes, all these environmental things can disturb the Shen, but damp inside the body also. Deficiency of yang, of the Tai Yang, of the sun inside, which is the heart, also can disturb the Shen. But also other persons can disturb the Shen also, you know, because as I say before, the mind is the disease, as Sanzeng, the third Saint Patriarch, says, you know, and yeah.
And how would you explain in this context emotions? What are they? They are movement of the Shen, or well, the cause, or the you know.
Well, emotions are a different expression of Shen that should be stored in the organs, in the sun organs. So when we express those emotions, then we are sick. So mostly we all are sick, you know, because emotions move the energy, move the yang, the fire. And when you move the yang or the fire, let's say that, for example, sadness consume the yang, no, the energy. Fear collapse the energy, and so on. You know, every emotion will move the energy because it's so subtle. The energy is so subtle that it moves. And while it moves, it cannot be inside the organs. So every time you move the energy in some way, you are consuming it, you know. So this expression of those things, this expression of Shen is just what cannot be stored in the sun, you know. So this is why Sakyamuni say Shinkong. So empty your heart. Empty your heart means is have no emotions, you know, have no attachments. So, but this is very difficult. This is a very difficult. No, yeah.
Thank you.
Any other question?
Hi. I have a question. The last formula the one for the PTSD and the psychological trauma, would that formula be appropriate for those that are depressed, bipolar, OCD behavior?
Yeah, also you can use also.
Because that when it becomes chronic, people can developing things. Yeah.
Well, every formula have their own pattern, their own syndrome. So we have an expression that say "yo tren, yo fan." It means that if you have that syndrome, then you have to use that formula. So it's not only that formula when done tan. It's any if the syndrome that have that person fit into the syndrome of the formula, then you can prescribe that formula. I don't know if you understand what I mean.
I think I do, yeah.
Yeah.
I like the way you teach. It's different to what I was taught, but it's more wholesome.
Thanks a lot.
Thank you.
Any other questions?
Hello. What about when it's the eyes are swollen and itchy also?
Swollen and itchy. Swollen and itchy could be allergies, you know. So maybe childhood is very good, because childhood have to do in a way with also with the exterior, you know, with this maybe it's swollen and itchy. Itchy is related to the heart also, so it's related to the Shen. When you have itchiness, it's because it's related to the fire. So itchiness is let's say that it's a bad communication of the Shen. It's a bad communication of the heart with the exterior, you know. So we feel things that we shouldn't. So itchiness is related to that, especially if it's red, no? This is itchy and red. So allergies, for example, you can use chaihu or any herb that is bitter in nature, because bitter can make the fire or the Shen descends. So you can use lian chao. Professor Huang used a lot lian chao, which is another herb. But chaihu could be used in that time. Yes.
Thank you.
You're welcome. Any other question?
What about the use Tahuang in some psychological problem?
Yeah, of course, Tahuan is another in the, for example, in the Huangtin Aging. In the Huangtin Aging, all insomnia cases were related to some obstruction in the Yang Ming. And this obstruction in the Yang Ming normally is related to some more physical, more thick obstruction. So Tahuan, when you have obstructions where you have to use Tahuan, the person start to have some incoherence in their speech. And as we said, speech is related to the heart, to the Shen. No? So when the person start to act a little bit like madness, or there is an incoherence in the speech, or the person start to forget things with abdominal distension, problems with the feces, like dry feces, which you can see in a lot of dementia. Dementia cases are related to a bowel problem. There is I'm sure that you know, there is a relation between the bowels and the brain. So Tahuan is used for this kind of syndrome. But Tahuan is a more excess syndrome. Normally, the one that I explained before was almost all were like deficiency symptoms. So childhood, Guizhi, in all of them, you have a deficiency. Panxia also. But Tahuan, no, Tahuan is an excess. And Tahuan also speaks also about not only an obstruction because of dry feces, it's also because Tahuan in the Shandong Pensao is mainly a moving blood herb. So Tahuan also speaks about some blood obstruction in the Yangming cavities or in the lower jaw. So yes, madness is related to Tahuan. Forgetting things is related to Tahuan also. Dementia, Alzheimer, all of those are related to Tahuan. You have a formula like Tao He Chen Qi Dan, for example, where you move the blood and you free the ways of the Yangming. Tahuan is one of the few herbs that in the Shandong Pensao Jing is regenerative. It's a regenerative herb. So it can regenerate our cells. Maybe it's our brain cells, maybe. It's a very interesting herb.
So you can I ask something again because of that now?
Please.
Yeah, so basically just for patients with dementia then, you think it can offer some relief? Can you get some function, some mental function back? I know it's difficult.
I think that if you use herbs and diet is very important. I think that is you can have some improve, or because this is a degenerative disease, so you can slow down the degenerative process, which is already very good in this kind of patients. Also, there are cases using Tahuan to calm down the patient when he's mad. So there is a doctor that is called Hua Tuo, which was very famous 2,000 years ago, 1,800 years ago. And he used, one of his cases was using maybe Tahuan. He purged this patient just to calm him down, because he was acting mad. So this madness with this obstruction of the Yangming, they are related. So Tahuan is used in those cases. Yeah. Of course, when I say Tahuan, because we cannot forget that Jing or any formula or any doctor use a single herb. Is Tahuan associated to other herbs? Okay, it's a formula.
That's hopeful.
Any other question?
Yes, please.
Yes.
For the last thing about dementia, there is obstruction and dry faces, but very often I see in dementia that the pulse is very weak and thin. Is the very weak and thin pulse an indication also for the Dawang formula?
This is a very good question. So first, Tahuan, according to Shanghan Lung, according to Shanghan Zapin Lung, Tahuan can have a deep pulse. Deep pulse. So sometimes we confuse weak with deep, Also, there is different dosage of the use of Tahuan. So normally in the Shanghan Lun, we have Tahuan. The highest amount of Tahuan is 4 liang. Liang is a measure of unit of Han Dynasty. Okay, doesn't matter what it means now, but 4 is the highest amount. And there is also a use of Tahuan of 2 liang, which is half of 4. So for example, in formulas like quy制加大换糖, for example, it's a deficient condition. It's a deficient condition where you use dahuan. Maybe in those kind of conditions you will have, if you compare with the 4-lian formulas, maybe it's a more weak pulse, it's a more thin pulse. Then you have, for example, 大柴胡糖 also is 2-lian. 柴胡加龙骨茉莉, which is a formula that you can use in dementia, also have dahuan 2-lian, so a small quantity of dahuan. So I think yes, I think that you can use in that kind of pulse. The characteristic of dahuan, I think, is a slippery pulse, and a slippery in the Han Dynasty also means a fast pulse. So you can have a thin, weak, and fast pulse. Maybe that is a dahuan pulse. And I say maybe, okay, maybe. And this is very important, yes. So I think that yes, maybe if you use a small quantity of dahuan and you have a specific, you have this kind of syndrome, yes, you can use. Another thing is that sometimes you have some signs of symptoms that will tell you that you use dahuan and not necessarily the pulse. So for example, if you have a tongue with a yellowish and thick coating, and then you have an abdomen, a full abdomen where with gases, and when you press, the patient feel uncomfortable, and then you have dry feces, then maybe you can use this dahuan. Maybe you can use that dahuan. This is a very important thing also. And a dahuan person, a real dahuan person will be more extrovert, will have more oily face, will have he will want to eat a lot, but he cannot eat. He's the kind of person that will order a lot of dishes, but he cannot eat all of the food because he is already full inside. This is the kind of person that is dahuan.
Thank you.
Welcome. Any other question? Okay, if you don't have any other question, then I would like to end this this small talk. I'm very happy that all of you came. Just remember that we have, I will put here for you to see, we have like a serial of talks, a little bit to present what is Jing Fang and other, explaining other formulas. And also we have a Jing Fang course of 2 years that will start in March 2023. I invite you all to come to our next appointment, which will be the 7th of December. The 7th of December will be the next one, and we will explain Wen Jing Tang, which is an amazing formula. It's a formula for infertility. It's a really good formula for infertility. Also, if you want to visit our website, there is all the information in our website about our course and our free webinar series. Hope you enjoy this this short webinar, and I'm really grateful about all your questions and your insights. Thanks a lot. Bye-bye. See you in the next lecture. Let me just stop the recording.